Welcoming a newborn into the world brings a whirlwind of joy, wonder, and a whole lot of questions about their care. One of the first things new parents often notice is the tiny stump of the umbilical cord still attached to their baby's belly button. This small remnant is a big reminder of the incredible journey the baby has just completed. One tiny detail that plays a big role in those early days is the umbilical cord. This remarkable cord acts as a lifeline between a mother and her baby during pregnancy. It's not just a simple connection, it's a complex and vital structure. Through the umbilical cord, the baby receives essential nutrients and oxygen from the mother's body. This exchange is crucial for the baby's development. It's a vital connection that sustains the baby as they grow and develop inside the womb. The umbilical cord also carries waste products away from the baby, ensuring a healthy environment for growth. Imagine it as a superhighway of nourishment, constantly delivering everything the baby needs to thrive. This superhighway is made up of 2 arteries and 1 vein, all protected by a substance called Wharton's jelly, which cushions and protects these vital vessels. After birth, the umbilical cord is clamped and cut, leaving behind the small stump that will eventually fall off, marking the baby's first step towards independence. Understanding the umbilical cord's role helps us appreciate the incredible journey of life from conception to birth. Once the baby is born and takes their first breath, the umbilical cord's job is complete. It's no longer needed for survival. Doctors and midwives will clamp the cord and then cut it, separating the baby from the placenta. This leaves a small stump attached to the baby's belly button. Don't worry, this is perfectly normal. The stump will gradually dry up and fall off on its own, much like a scab from a scraped knee. The healing process of the umbilical cord stump typically takes about 1 to 2 weeks. During this time, the stump will change color from a yellowish green to brown or black. This is a sign that it's drying out and it's completely natural. You might also notice a little blood around the stump or on the diaper. This is also normal, especially after a diaper change or bath. It's just a small amount of blood, similar to a pinprick. Section 4. Hands off. Why pulling the umbilical cord stump is harmful. It's tempting to want to help the process along, but it's crucial to resist the urge to pull or twist the umbilical cord stump. Pulling can cause bleeding, irritation, and even infection. Remember, the stump needs to detach on its own to ensure proper healing. Think of it like a tiny scab. Picking at it will only delay the healing process and could potentially introduce harmful bacteria. Section 5. Gentle care for a little belly button is essential for a newborn's health and comfort. In this chapter, we will discuss safe practices for umbilical cord care. The best way to care for the umbilical cord stump is to keep it clean and dry. This helps prevent infection and promotes natural healing. After each diaper change, gently clean the area around the stump with a cotton swab dipped in plain water. This simple step can make a big difference in maintaining hygiene. Avoid using alcohol or soap, as these can irritate the delicate skin and potentially delay the healing process. Plain water is gentle and effective. Fold the diaper down below the stump to allow for air circulation. This small adjustment can help keep the area dry and reduce the risk of irritation. This will help keep the area dry and prevent rubbing against clothing, which can cause discomfort or even infection. If the stump gets wet during a bath, gently pat it dry with a clean towel. It's important to be gentle to avoid causing any damage to the sensitive area. Regularly check the stump for any signs of infection, such as redness, swelling, or a foul odor. If you notice any of these symptoms, contact your healthcare provider immediately. With proper care and attention, the umbilical cord stump will usually fall off within 1 to 3 weeks, leaving behind a healthy belly button. Remember, gentle and consistent care is key to ensuring your newborn's umbilical cord heals properly. Your attentiveness will contribute to your baby's overall well-being and comfort. Section 6. Trust the process. A reassuring note on natural healing. When it comes to the delicate and intricate process of healing, nature often knows best. The healing process of the umbilical cord stump is a natural one. This small yet significant part of your baby's body undergoes a transformation that is both fascinating and essential. It may seem a little strange at first, but it's important to trust that your baby's body knows what it's doing. The body has an incredible ability to heal itself, and this is especially true for newborns. By following these simple care practices and resisting the urge to interfere, you can help ensure a smooth and healthy healing process for your little one. Keeping the area clean and dry and allowing it to heal at its own pace is crucial. Remember, a little patience and gentle care go a long way. Your calm and attentive approach will provide the best environment for natural healing. Trust in the process, and soon you will see the remarkable results of nature's work.